Good morning, everyone, and welcome back to Brainstorm Health for a special session we are hosting this morning together with our partner, McKinsey & Company. And we're going to start with a bold and big vision. Imagine a world where the disease burden is cut nearly in half. It's possible, according to a new report from the McKinsey Global Institute entitled Prioritizing Health. This report finds that using interventions in existence today, the global disease burden could be reduced by 40% over the next 2 decades. And that is a beautiful vision indeed, and we want to drill down on how we can reach these goals today. There's no better time to do it than now, and no better person to lead the discussion than Fortune Editor-in-Chief and my boss, Clifton. Today, he's speaking with an all-star panel: Shubham Singhal of McKinsey, Amy McDonough of Fitbit, Mikelle Moore of Intermountain Healthcare, and Asheesh Saksena from Best Buy Health. Before I hand it over to Cliff, just a quick note on how you can join the conversation. If you'd like to ask a question or share a comment, enter it into the chat function on the right side of your screen. Once we see it in chat, we'll call on you to come forward so you can ask your question on camera. In order to do that, all you have to do is click on the Share Audio and Video tab on the upper right-hand side of your screen. And just as a basic programming note, if you're on camera but not speaking, please mute yourself. It just eliminates background noise. And with that, I'll hand things over to Cliff.
Thank you, Ellen, and thank you to all our distinguished guests for joining us this morning, and for all of you. I'm thrilled for this conversation for two reasons. The first is that I have long believed in the power of prevention and early detection, and really understanding that we can have a healthcare system that's not fix it when it's broke, but stop it from breaking in the first place. So that's the first reason that I'm excited, except the challenge has always been putting numbers on that, to putting a value on doing that hard preventive work at a time, and understanding the power of social determinants and quantifying that value. So that's the first reason I'm excited. The second reason I'm excited is that I'm an optimist and I love silver linings. I always have. And, it's great to think that this COVID-19 offers an opportunity to actually recreate the health system and get us to a starting gate that actually makes sense for the race we want to run. And with that, I am thrilled to ask Shubham of McKinsey, who's put together this absolutely incredible report. Let's start with some big numbers. There's this $12 trillion in global GDP that we could benefit from. That's an 8% improvement on real GDP globally. And in the US, it's about 2.7 trillion, if memory serves. And that is basically on a year-over-year basis, that's a 0.5% increase in global GDP. Shubham, tell us how you calculated this and what the key highlights of that report are.
No, thanks for having me, and thanks for the question. So one of the things that when we looked at this research, the conversation around healthcare had really become one about cost, and the cost of healthcare that's become unaffordable and run away. And so what we wanted to understand, because if you look back into the last century, the growth in GDP, a lot of it can be traced back. A lot of historians have written about this, to the expansion in lifespan and productivity of the workforce. What we found was known interventions, as Ellen said, can reduce global disease burden by about 40%. Specifically, what that means, if you leave the technical speak aside, is that 65 could be the new 55. So it is 10 years of healthy and productive life extension, not just life extension, but healthy and productive life extension. And so when you look at that, what that means is that from a standpoint of premature death, so we lose people early, and standpoint of where they are in ill health and therefore have to exit the workforce and exit what they are, their ability to be productive, we can actually change that. And that 10 years of people being available to work, people being able to work, and that is what really drives the GDP numbers that you said. Now, by the way, just to put this in context, that's the upside of the $12 trillion that we talk about. The downside today is, so COVID-19 is going to take about an 8% bite out of the global GDP this year. Poor health takes a 15% bite out of GDP every year, just to put it in context. And that's kind of what we're really talking about. Now, final thing I'd say is that the kinds of intervention that we're talking about are not rocket science. You began this with prevention. Yeah. We know what we have to do with chronic disease burden and how we can drive, catching it early. There are very hard behavioral changes. There are communities that we live in and the health of those that matter. In places like the United States, we've understood the impact of social factors that drive into influencing a person's health and lifestyle. So there's a lot that happens, about 70% that is outside of the clinical setting. Mm-hmm. It's health broadly outside of the clinical setting. That's why I'm excited with some of the colleagues here, including I know Asheesh, and how we're thinking about how we engage people beyond just when they show up to a doctor or into a hospital.
Yeah, I'm 56, and I was hoping that 65 would be the new 40, not the new 55. But I'll take it anyway. I've got 10 years to go back to where I was. I think that one of the key factors, as you said, is this, as dramatic as the hit to GDP is from COVID-19, it's twice as much, at least when calculated by factoring in all the issues that you factored in. It's twice as much of a hit just in terms of the inefficiencies and lack of preparation in the healthcare system. And now you also mentioned the social determinants, these social factors, the communities that we live in, the zip codes. This increasingly has been the conversation du jour in healthcare. We're really starting to see that well-being isn't just something that's manufactured in a hospital or clinical setting, but really in the community. Whether you have a roof over your head, whether it's safe to walk out your street, whether you're eating well, whether you have access to care, all of those things. And so how is that conversation changing in your mind? This is McKinsey, you talk to big companies. Are they getting this, your clients?
I think I would say that people were beginning to get this in the policy circles in healthcare. I think with COVID-19, everyone is beginning to get this. If you just look at some of the basic statistics, the COVID-19 and the death rate has just been higher in African-American communities, for one. It has been higher where people have lower incomes, not great access to care. It has been a lot higher with people who are obese or have other underlying conditions. So all of this that we've been talking about has become extremely real during this point in time. And so if you just look at whether it's business leaders in a way that perhaps felt like an academic conversation sometimes, has become a very real one, because we're seeing a very direct and in a very short period of time, real impact to people's lives. And that is something that we can't ignore. So I'm actually hopeful that this becomes a turning point where many of the things that we've been writing this report, obviously doing the research over a long period of time, and COVID-19 just made it so apparent as to what the vulnerabilities are as in the way we think about health, that it is becoming actually quite relevant today.
Yeah, and Asheesh, I actually want to go to you now because some of this sort of shock to the system has changed the way regulators and many people in the larger health ecosystem think about what's possible and think about what should be. So we've seen several orders that have made telemedicine more feasible, giving us billing codes, making more acceptance of telemedicine and televisits, teleconferencing in general, for in the healthcare setting. And you're going after, at Best Buy, a group that historically hasn't been used to seeing their doctor that way, seniors. How has that been internalized in your experience?
Sure. Cliff, firstly, thank you so much for having me join this panel. I'll just take one step back and connect it to what Shubham was talking about. At the core of our thesis in Best Buy was a very simple idea, which was that home is going to become an increasingly important site of care. And COVID has completely put spotlight on that in that paradigm. And for seniors, the question you were asking, for them in particular, home, be able to access healthcare in the home is now ever so more important because the risk of infections and all the rest in the facilities-based environment. And to that extent, we have been actively working with millions of homes that we serve where seniors or caregivers reside, and trying to equip them to be able to access healthcare through all sorts of technology solutions. What is fascinating is how easy it was to be able to configure homes. It does not take a very complex infrastructure, and B, how amenable the environment is to be able to use these tools, because there is just no other alternative. And so I think at one end, which the variable that used to be the hardest to move in healthcare, which is changing consumer behavior, has got forced to change. And then everything else were these enablers around it, changing the regulatory construct, the availability of physicians digitally, and new reimbursement codes and so on, but all the various catalysts that did that. So we are very encouraged. We do think that this is a lasting shift. It may not rebound to the same levels, but it's likely to change the way we access healthcare.
So one of the aspects of this is, we're comfortable when the doctor sees us, and it's great to be able to, have that that visual connection. But we also, for increasingly, we'll need sensors and devices to measure things. Amy, I've got my Fitbit here, and it's that's not a product placement. I'm just happy to wear my Fitbit. But increasingly we're learning things that we can do with these wearable devices that we used to think of as medical devices. I mean, I know that's a dangerous term in terms of FDA regulations, so I won't have you say it. But we can check to see if somebody has atrial fibrillation. There's some very big studies on that. We can see obviously respiration and heart rate. Where do you see the next sort of dimension for some of these wearable devices? What will we be able to measure that will bring some of what Asheesh and Shubham are talking about and make it reality?
Absolutely. So Cliff, as kind of Fitbit's mission has always been 13 years to get healthier. And I think what wearables do, as you mentioned, is help make what was previously invisible visible to consumers and to members, right? So taking something like heart rate that wasn't really understood or at an individual level, and being able to make that understandable and just relatable, and it's a metric that now people can measure. And what we're seeing is that, as you mentioned, both the importance of whether it's digital clinical trials and or the ability to bring new kind of early detection of illness to the wrist by the use of kind of these health metrics. One of the most important ways we're seeing that right now obviously relates to COVID-19. So based on some earlier work that we did with Scripps Research Institute, they published some data in the Lancet looking at data that was able to take heart health metrics and look at those and be able to then look at early detection of flu. And now what we've done is launched a clinical trial to be able to look at those same metrics. So heart rate variability, your respiration rate, how could those be early indicators of illness? And obviously knowing just a little bit, we have a lot to learn obviously about COVID-19, but being able to understand that the asymptomatic and pre-symptomatic are really an important piece. And the earlier that we can catch illness, the safer we can leave communities and businesses and education. And so that's what we're really excited about, is to be able to do that and to be able to do that at scale.
Right. And identifying those kinds of infections, that's what often brings somebody, not just into the clinic, but often into the emergency room or, into some of the expensive parts of the healthcare, which we would love to be able to reinvent. Mikelle, it's great to have you because you're at Intermountain Healthcare, which has been sort of a leading edge of hospital systems, of health systems when it comes to investing in digital technology, investing in also prevention. Talk a little bit about how you see this revolution happening, and well, first, whether you do see it happening, some of the stuff that Shubham has talked about, but how do you think it can accelerate?
Clifton, thank you, and thank you to McKinsey for the opportunity to be here. First, I do believe this revolution is happening, and like you, I'm an optimist. This is a revolution that I think actually COVID has advanced our work towards a technology-driven access healthcare, driven us forward at least 2 years. It means that Intermountain Healthcare, for those who may not know, is an integrated system that has changed the business model so that we are in a position where more than 40% of our business is at risk, meaning that we get paid whether we deliver healthcare or not. We're incentivized to keep people healthy. So we've been driving forward a business model to integrate telehealth, both for providing and extending care into rural communities and small communities where maybe you might not have access to a critical care physician or a nephrologist or a rheumatologist, but you have disease and need access to care. And we've also been taking a very consumer-driven approach to healthcare by creating hospital care at home, primary care via virtual visits, and all of that's advanced through COVID dramatically.
I want to have a conversation where people can feel free to jump in a little bit and answer each other's questions. Shubham, I want to talk about one of the areas that you zeroed in on, which is cardiovascular disease. And that's an area, obviously, it's accounts for a tremendous amount of mortality in the U.S. But you pointed out that deaths from heart-related illnesses are about twice as high here in the United States as they are in Western Europe. I always think of Europe as the sort of home of smoking and whatnot. But what are the behavior changes that you see that, apart from smoking and lack of exercise, that can lower that rate here? What is one of the interventions that you were most excited or thought was most feasible?
I think clearly smoking is an important factor, but a number of the other factors, and this is where healthy lifestyle behaviors really kind of come in. You mentioned exercise, that is known and well proven, particularly given the rate of obesity in the United States relative to Europe just is much higher, and that is a precursor to a number of conditions, diabetes and cardiovascular being two of those. Now that has a lot to do with a lot that happens before people show up again into getting care. It has to do with exercise. It has to do with nutrition. By the way, on nutrition, there are two different kinds of problems that we have to deal with. One is just the behaviors on what people are consuming and how much they're consuming and how all of that works. But we've also seen on the other side, to the earlier point around social factors, there are people who don't have access to healthy food,
right,
and or don't know how to actually then cook at home and get the right kind of groceries, etc. Now, in this COVID moment, it's interesting that people have been eating more at home and going back to a bit more of the cooking, etc. Maybe some of it was too much baking, not as much healthy cooking, but there is an opportunity to kind of really figure out. There are some health systems who've engaged with their patients and communities. You all probably have seen with the fresh food pharmacies that Dave Feinberg, when he was at Geisinger, he started and put in place. You've seen with classes that a number of health systems are running around helping people figure out how to make healthy choices, how to do easy to cook recipes and the like. But there's a lot around nutrition that needs to happen. And then if you look at our healthy environments, this one is an interesting one. Do we have the right kind of communities where you can actually get in your normal day-to-day life a lot more walking, etc., to happen? Do we have the setups, if you will, in our offices and office buildings Mostly, if you are in the US, in most parts of the US compared to Europe, if you wanted to use a staircase, it's a lot more difficult to find it. Would you get stuck in there? And, so I think
let me
those are some of
jump
the
in
kinds
right
of
there
things.
because, we're right now, obviously all of us are having this meeting remotely. The scores of people are watching at home or watching us remotely. Many of us are not going to the office. Unfortunately, I am in the office, but don't want to be. But, we're not getting the kind of daily exercise that we normally get, and so, I see you nodding your head, Mikelle, and Amy, of course, this is, you're probably seeing this with your wearable devices, actually tracking our movement. Amy, why don't you just tell us, is that true?
Yeah.
Are you tracking us? Are we all a bunch of couch potatoes now?
We've actually seen some really interesting trends. And just to go back to what our colleagues are saying, it's really about a proactive approach to health and holistic well-being around activity, sleep, nutrition, and mindfulness. But you're right, we've been doing a lot of looking at a population level based on our 30 million global users and kind of what's happening with the trends with a lot of us not being out into the world as much as we typically are. There's been some really interesting trends. One that I'll point out as it relates to activity is that, yes, we are getting less steps. We're maybe moving less throughout the day, but our amount of what I'll call purposeful activity is actually going up, meaning people are taking that, and I know I do this, instead of my commute into the Bay Area, into San Francisco, I'm taking that time. And so we're seeing that purposeful activity is going up. And what that's resulting in is actually statistically significant decreases in things like resting heart rate, which is a real key indicator of health overall and heart health. And so I think while we all might be eating more sourdough starter breads and things like that, I think we are actually being mindful around activity, our sleep, our heart rate, and I'll just add that sleep is another one that we've seen some increased rest and more consistency in sleep, which is also important for maintaining good immunity. Yeah. So we're seeing some really interesting trends.
We've got some awesome questions here, but Asheesh, I actually have an important question for you, which is about many companies are actually hurting now, financially. This is a very, very challenging time, as we've seen the 8% hit to GDP that Shubham mentioned in the report. But do companies actually want to start spending money on this sort of care at home business that you're selling right now? I mean, it takes, we often will invest in flush times, not in tough times, even though it should be the opposite.
Yes, actually, we have seen a relatively steadiness in the spend, and actually perhaps an increase rather than reduction. And that's largely because some of these solutions have proven to both improve outcomes as well as reduce costs. And both of those become imperative in these sorts of massive macroeconomic dislocations. We have published a couple of peer-reviewed articles just to quantify the impact of all of that. So I think because it does both of those things, outcomes and costs, it actually becomes prioritized to spend.
Oh, that's great. Mikelle, Intermountain has an unusual model in that you kind of own the healthcare dollar with your insurance arm. And so, you can actually incentivize the kinds of behaviors that Shubham and McKinsey colleagues have talked about. Are you actually saving money on this, or from your experience?
We are saving money from this. And there were a couple questions in the chat I think I can speak to. One, does adding these services just increase utilization of healthcare services overall, because you're now accessing services via telehealth and then also going to the doctor or something like that? We're not finding that. We are finding that people are utilizing telehealth in a way that it becomes a part of healthcare. Now, the reason for that in our system, frankly, is because we've integrated it. When you get care in our system via our Connected Care telehealth product, the information captured there goes into the electronic health record and used by other parts of the system, so that one visit builds into another. We're also able to deploy hospital services in the home and engage medical providers that are part of the system in delivering that care through the resources that are deployed in the home. So it's a part of an integrated approach. And I think that's been key for us in being able to actually improve health and reduce utilization overall. The other thing that I guess I'd love to comment on is there was a question in the chat about how are these things being experienced in terms of disparities? Are people with higher incomes accessing services differently than people with lower incomes? And we are looking at that very carefully. In the early days of COVID-19, the number of calls coming into our COVID hotlines and other resources that then directed people to testing or to services, we did see disparities. More white people accessing services that way and more highly educated people accessing services that way. So we've had to be really intentional about designing services that were Spanish speaking and promoted by community organizations that have trust in individual neighborhoods or in different ethnic communities in order to create that same engagement. And that's still a work in progress.
Well, that's a critical issue. We want to bring in Yana Remes, a partner at McKinsey Global Institute. Good morning. You know, as we sort of, what is the part of the conversation we're missing here?
I'm an economist by training, and collaborating with Shubham and other colleagues who work on the healthcare industry all the time has been a real eye-opener for me, because as Shubham started saying early on, we have always thought of health as a potential cost. We don't look at the upside of the economic returns. And really, it is that potential for us at the unique time in the COVID pandemic right now, is that we could actually get both better health and prosperity at the same time, not merely restore the past, but really boost growth over time. And that for me, as an economist, is a really good message. And I think one that we should have much more broadly, not just within the healthcare community.
Yeah, I'd love to bring in some of these great questions. I mean, I think that's a great point, Yana. You know, too often we think of health spending as a cost. In fact, on the P&L, it shows up as a cost. So, you know, I think that part of that is in education to businesses and you know, community leaders about trying to show what you're showing in this report, this terrific report. You know, I actually would love to get Philip Adela. I don't know if you want to request that your camera come on, but your comment about getting the evidence about social determinants of health and how impactful it is.
Yes, we're beginning to see that payers are recognizing, right, that paying for these are important. And so starting with, for example, food security, there is a fair amount of effort. I mentioned an example earlier that is an important part of improving health and health outcomes is certainly one that folks are looking at. There's numerous others. Some of which, as you can imagine, are more connected to healthcare. So the nutrition angle, you can see. Some of these are more connected to social aspects, right? And things like security, just having the secure environment, if you will, that we also have to think about. I'll also tie it to the question that Mark had there around mental and emotional health. That is a big factor that kind of plays into this as well. The part that obviously connects quite directly into healthcare is that is an area that the access to mental health care is actually quite low. And so there is more investment going in. You've all kind of seen with more government funding, et cetera, as well, kind of going in, but there's a lot more that needs to be done. But Philip, you should take your question.
Yeah, sure. Thank you. And I think that speaks to it. And I think the basis of the question is there's evidence that we're all seeing. And I think we all believe that the social determinants of health and the predictive and preventive activities drive down costs. The question is, are the people that are currently bearing the costs willing to invest in that proactive? And as a company that has a P&L cost for healthcare, are they willing to invest in the preventive devices and activities to actually help drive down the cost on the other side?
And in fact, that's a good question. Asheesh, I just want to bring in Jennifer Tescher's question, which aligns with that, which is Best Buy, investing in its own employees with some of the technology that you've got? And are you seeing any results from it?
Yes, let me actually address both of those in one answer. So, Philip, I think to your point, one of the things that Best Buy was doing and is continues to do is to work with payers and providers with a very simple solution, which is to go put into people's homes tiny sensors and pick up data associated with activities of daily living. That is mom tossing and turning the bed more than usual. Is she coming down and opening the refrigerator enough number of times? How she, is she going to the bathroom more often? Then run some AI algorithms to do some sort of a predictive estimation whether there is an issue or not. Almost all our care and provider clients are actively engaging in that dialogue, either working or doing it in different ways. So to answer your question, is the industry actually embracing and investing in these sorts of solutions? The answer is categorically yes. So that's a good part. The second, just to connect to Cliff, the question that you had about Best Buy using it. Best Buy has a very robust employee benefit construct. Which looks at all aspects from financial security to physical security to emotional and mental health security and so on. And just this example that I was giving of deploying a solution that puts sensors in people's homes and pick up data and be able to provide meaningful insights is yet another of those things that we actually first work with our employees to see how it would work and does it have a meaningful impact and so on and so forth. So I do think that given that we are, like many other companies, are self-insured employers, for us to deploy these technology first and digital first solutions to improve health outcomes of our employees and eventually reduce the cost to serve them is a very meaningful part of how we do so.
I just wanted to add there that I think we're really seeing the payer and providers, as well as employers and the education sector, really step up and be interested in both taking a proactive approach to health by providing tools and solutions and really holistic approach, whether that's coaching or devices or a program that works for them and to help address the mental health impacts that we were speaking to earlier. We actually just launched a Ready for Work solution, which is combining that early illness detection that I was mentioning and how your personal metrics might change if you're fighting off particularly a viral illness, but also combining that with mental well-being and emotional health tools to help individuals kind of going through this. And that's being really well received by employers and payers who are looking to really provide those solutions in a safe environment and confident.
Great. Melanie, I know we've got more questions, a bunch, actually, great ones.
We sure do. We've got several on the impacts on consumers. Andrew Churn, I was wondering if you'd like to join us and ask your question about what it means to be self-diagnosing at home as a consumer.
Yeah.
His question is, when we put diagnostic tools in the hands of consumers, is there a concern about unintentionally driving up the public health, the healthcare costs and the burden on the public healthcare system with people self-diagnosing inaccurately based on both the accuracy of the technology and proper use of devices, or maybe we're just nervous people? How are you thinking about helping with the learning curve for consumers?
The one thing, the part that I would say on that is the point that Mikelle made earlier, which is this is we have to rethink health, whether it is self-enabled care or it is clinically provided care and all that is in between, as an integrated view, right? So the ability to have the diagnostics, a simple view that says, maybe there's something that's going wrong, or you're not meeting your goals, you didn't work out enough, etc. Those are fine. If it says, look, your heart rate seems to be out of whack with what would be normal, well, that should lead to, at a minimum, a telehealth call to your primary care physician, if not to set up and schedule a visit. So I don't think we should view this as we will just do something at home, then we'll do something in a retail clinic, and then we'll do something in with a doctor. It has to be integrated. And the point around the connection of the data that needs to be across all these different, if you will, as Asheesh put it, sites of care. If home were a site of care, we do need the data to be believable across all of that and tied in, so that the physician, for example, if you have your PCP, can look in and say, okay, I do need to engage with this person, need to give them a call and have them come in. I think that's what needs to happen, rather than viewing it just as a, let consumers figure it out on their own.
Ellen, we just have about 10 minutes left, and we have so many good questions. Maybe we could just read some of those. And then also, I want to point out that Kathleen O'Neill from Fortune has put in the McKinsey report into our chat room for those who want to download it. It's actually live today, so you'll be beating your friends and neighbors if you download that report.
Cliff, we have a lot of questions about the business model of health.
Yes.
Here's a great one. How do we solve the conundrum from Syriac Redding that there is much more money to be made in therapeutics than in prevention and diagnostics?
Great question.
There's a cemetery of diagnostics and prevention startups. Everyone's tried and failed. What's the business model? What is the solution?
Great.
The business model is changing the way we pay for healthcare. We need to use a model that pays to keep people well rather than pays for the diagnostics and the sick treatment care. And so risk-based models work. When we pay for care on a per member per month basis and are incentivized to keep people well, it works. So we need a business model that allows for that to happen in the way businesses buy healthcare, but also the way our government pays for healthcare for Medicare and Medicaid.
Yeah, Gustavo Morales has a question that really speaks to that. It's very straight. Are insurance companies paying for these kinds of devices?
Just a very quick point on this. The evidence right now to that question is, if you look at Medicare Advantage, while it's not perfect, it pays for quality, it pays for experience, and it pays for total cost. And most of the payers as well have much more closely partnered up with providers to have providers take on more of the risk, to the point that Mikelle was just making. And so you actually are beginning to see a model which is showing that kind of view. And of course, anything that can drive cost, quality, and experience to be better, those models are being paid for, and a lot of venture cap and PE investments are going towards companies that do serve into the Medicare Advantage market. So I would say there's emerging evidence that yes is the answer to that. But sorry, Amy, you were making a point.
I agree with that as well. Thank you. I mean, I think we are seeing across the types of plans and programs integration of devices and a proactive approach to health. So we're seeing that in commercial business, trying to align incentives, which is what Mikelle was speaking to, but also, in Medicare and Medicaid, incorporating devices to really empower across the ecosystem tools to help take proactive care to health. So I think we're seeing those signs as well, and I think it's really encouraging around where the industry could go with tighter integration and better alignment around incentives.
So I think the last question, which will bring us to an end, hopefully will be the most inspiring one, which is about mental health and stress and work. Yeah. And it seems to everybody in the chat who's talking about this, excuse me, that we can't make this work if we are burned out, if we are stressed, and of course we're living in these incredibly stressful times. What is the employer work role in all of this?
It's a great question. Who wants to take that? Somebody. I can't believe you're not all jumping for this.
Someone who's not working 20 hours a day.
Yes, exactly.
I mean, I think
that's a good place for optimism as well. Clifton, back to your opening comments, that COVID is enabling us to think differently, even about the way that we support employees in the workplace. There are a lot of positives in working from home and flexibility that we're hearing from people regarding work that can be integrated as we go forward into COVID or beyond COVID times. We're also knowing that access to mental health has never been adequate in our country, and that we've had to come up with some creative solutions in this pandemic time. We've stood up an emotional health relief line. We've been able to convert a lot of the behavioral health care that we're providing to virtual visits, and are using non-psychiatry professionals even to help extend reach and capacity. Those things are going to be really important for transforming the mental health community and thinking more upstream about how we prevent and create a work environment that produces health. And I think employers are really listening to their employees right now about what's working about this situation and what isn't working. Maybe asking better questions than we've ever asked of the workforce about what it's like to go to work every day. And so let's listen and then redesign the healthcare aspects of it, but also the parts of this. It's a great time for thinking differently.
Could I add a quick comment on that one?
Yeah, please.
Just the way it is in healthcare, where we have an opportunity to reimagine the future, I think so is the moment to reimagine how we work. And at least in the last few months, what we have noticed are two things, one positive and one we have befuddled. The positive part is that actually the amount of work itself has radically changed. These are the times where you don't need to do everything in the old ways that you used to do it, and because of that, there is some newfound efficiency. So one is just the nature of work, the quantum of work itself has changed, and that's been helpful. And I think the challenge that we face, and we are ideating all sorts of interesting ways to solve this, is how do we recreate serendipity? Because once upon a time when we were all in the office, we used to walk around and chat and meet people in corridors, and new ideas would come. And then how do we create that in a digital environment?
I think we've covered a lot today, and that was an inspiring note to end on, so thank you so very much. We are going to once again thank our partner McKinsey for making this special Brainstorm Health session possible, along with so many other wonderful things they make possible in the world and for us. So we will be seeing you shortly on the main stage for our very exciting event, and some wonderful stuff coming up, Cliff. I'm really excited.
Okay.
So thank you, and we'll see you shortly.
Okay. Bye, everyone. Thank you.
Thank you all.
Thanks, everyone.